Hello everyone, I am Dr. Manoj Bachhav, plastic and cosmetic surgeon, and today we are going to discuss regarding rhinoplasty. So rhinoplasty is basically changing the shape of your nose. This is one of the surgery which is quite in demand in recent years, and we are going to see what is rhinoplasty, what are the indications, various indications of rhinoplasty, in whom basically we can do the rhinoplasty. We'll see the post-operative care, and what we will see along with the examples, the patients we have done, if it fits into that category. We'll show actual patients pre and post results also. So let us start with the basic, that is what is rhinoplasty, or in simple man's term it is also called as nose job also. So rhinoplasty, as the name suggests, rhino meaning nose, plasty meaning to change the shape. Basically changing the shape of the nose for making it more aesthetically pleasant or better looking nose. To create a better looking nose is called as a rhinoplasty. So when we combine this rhinoplasty along with the deviated nasal septum, some patients have difficulty in breathing. They have the nasal septum deviated and blockage of the nose on one side. So we can combine this rhinoplasty cosmetic procedure along with this functional disorder, that is deviated nasal septum. In that case it is called as septorhinoplasty. So it can be combined with the DNS surgery also, it can be done in the same setting. So in that case it will be called septorhinoplasty. So basically we will see the indications in whom what are the indications in whom we can do this rhinoplasty. We'll see one by one. So the basically we can see can be done for the excess of the to removing the excess of the dorsal hump. So if you have the convex excess curvature of the dorsum, that can be straightened out. As you can see in this photograph, the young boy, he has the excess of the curvature of the dorsum. So we have made it straighten. The nose is now completely straight and pleasant looking. So this is done for the dorsal hump reduction. Then it can be done for the saddle nose deformity, or we can see a concave nose to make it straight or narrower. So you can see this again, the female patient who has the concave nose, also the nose is broad. In this case we have put in a costal cartilage over the dorsum, so that the making the nose straight. Also we have done the osteotomy, so that for the narrowing of the nose, so that now her nose is straight, it is not concave, and it is narrow also. So this is called as augmentation rhinoplasty. So this is one of the most common indications, saddle nose and the broad nose. Then we can do surgery for the deviated or the crooked nose. If the dorsum of the nose is deviated or it is slanted on one side, we can straighten the nose using this procedure. Also it is done for it can be done for the elevation of the nasal tip, or if you have a depressed or a broad nasal tip, that can be elevated. As you can see in the figure, the patient has the short length of the columnar length is less, also the tip is depressed. So we have done the columnar lengthening, we have lifted the nasal tip, and we have also sharpened. So sharpening of the tip is called as tipplasty, and we have lifted the nasal tip, that is using the columnar lengthening. So this is again one of the indications. Then the next indication is the broad nose, that can be narrowed down. If you have an excess soft tissue on the nose and the middle part of the nose, that can be taken care of. This is called as reduction rhinoplasty. Along with that, there are some indications such as SCLND, we call it secondary cleft lip nasal deformity. These are more complex deformities that can be again corrected using this rhinoplasty surgery. So how does this is performed? This is actually performed under general anesthesia. The incisions, they are taken usually inside the nose, and the columnar incision, which is again hidden, so no scar is seen in the post-operative period. The patient needs to be admitted for 3 to 5 days. The nasal pack is both nasal packs are placed for around 48 hours, and there will be a splint over the nose for around 10 to 12 days. So once the splint is removed, you get the you get the final shape after edema reduction around 2 to 3 weeks. Once this surgery is done, it is permanent and long term. You don't need to do again a repeat procedure after some years or like that. One more thing, a word of caution for the rhinoplasty. It can be done using an autologous cartilage, that is the own cartilage from your body, either from the septum or the conchal or the costal cartilage, or alternatively silicone implants can be used. I personally won't go with the silicone implants as there is high chances of extrusion and infection, so we prefer using autologous costal cartilage only, so that it is your own body cartilage, so body doesn't give reaction to it, there are less chances of infection, and we get the better natural looking results also. So this is regarding rhinoplasty. Again, many people are worried about the post-operative results and how does it is going to look, whether it is going to be durable or not. So it is going to be the long term. The results can be discussed with your plastic surgeon. He needs to analyze, we need to first analyze your face, your nose. We need to see that the deformities that can be corrected. Many times there is not a single deformity, there is a combination of the procedures that needs to be done in the nose, and then we can get the final result. Also, the patient's concerns need to be taken care of. Which area patient is more concerned about, that areas are addressed primarily, and then we can go ahead with discuss the final plan with the patient. The expected result, there are softwares which can show the simulated results, or we can simply show the similar kind of the patients which we have operated, the pre and the post, so that you get an average idea how the results are going to look like. So this is definitely the procedure again which is very satisfying. There is a drastic change, because changing the shape of the nose is something which completely changes the complete look drastically. It definitely boosts the confidence of the person to a high level, and definitely a rewarding surgery. If you have a deformity of the nose or along with the nasal blockage or something, can go ahead with this and change your shape of the nose and indirectly your completely facial aesthetic permanently. Thank you.